Zimbabwe's cholera outbreak is reaching dangerous levels of infection, and the international community is beginning to worry.
As of today, there are over 15,500 cases altogether and over 740 deaths, which is a huge number.
Cholera is spreading at a feverish pace under the weak oversight of the country's crumbling healthcare system and weak infrastructure. The lack of clean water makes it difficult to contain the waterborne illness. Last week, officials declared a health emergency.
But in the worst case scenario, the health sector, the health agencies are dealing with 60,000 cases.
Western leaders are pressuring Zimbabwe President Robert Mugabe to improve the country's deepening humanitarian and political crises. President George W. Bush, British Prime Minister Gordon Brown, and French President Nicolas Sarkozy are calling for the 84-year-old leader to step down. But Zimbabwe's government says the disease is under control.
There are already some cases in Botswana, of course, in South Africa, but those two countries can cope with the situation. We are more worried if this outbreak was crossing the border to Zambia or Mozambique, because they don't have the infrastructure to cope with a major outbreak.
Aid agencies warn that the coming rains could further spread cholera, and a population already weakened by disease and hunger. Sandy Kozel, The Associated Press.
We are worried about a regional dimension. If it was the case.
I think it's important to note that the east of the Democratic Republic of Congo has been in some state of turmoil for over 10 years now, and there are conflicts between armed groups on the ground, there are conflicts between government forces and rebel forces, there are conflicts between new armed rebel movements that have recently moved into that area. It's a problem that has afflicted that region for some time, and it's probably fair to say that the problems facing eastern Congo are much greater than those in the rest of the country, particularly in terms of military conflict. These people have, to a certain degree, been caught up in something that was quite unexpected in that region. Many of them have been forced from their homes, many of them have actually lost many of their belongings, they're sleeping in the open, and the World Food Programme is airlifting food to them, but also medical supplies and also the diesel to run a trucking operation closer to where they're situated.